CPT code 96127, Brief Emotional and Behavioral Assessment Billing, is one of the most misapplied codes in behavioral health. The rules are strict, the pitfalls are specific, and most denials are preventable if you know what the code requires. CPT code 96127 is the Brief Emotional and Behavioral Assessment Code, scoring and documentation, per standardized instrument. Common qualifying tools include the PHQ-9 for depression, the GAD-7 for anxiety, and ADHD rating scales. Clinical interviews and non-standardized questionnaires do not qualify. Those must be billed under a different code. In 2023, NIMH reported 21% of U.S. adults experienced mental illness, yet only 46.2% received treatment. Bill more than 4 units per patient per date of service and the payer can deny the encounter and flag your account. Submit a non-standardized instrument or skip documentation and the payer can deny every unit on that claim. Systematic overbilling carries False Claims Act risk, financial penalties, exclusion from federal programs, and potential criminal charges. The clinical and financial case for billing 96127 correctly is clear. A 2022 study in the Journal of Clinical Psychiatry found routine brief screenings increased identification of depression and anxiety disorders by 35%. A 2023 American Journal of Managed Care Analysis found routine mental health screening could reduce overall mental health care costs by 15 to 20%. Billing CPT 96127 correctly comes down to 5 requirements. Violate any one, and you hand the payer a reason to deny. Let us walk through all 5. The assessment must be a recognized, validated, standardized tool. PHQ-9, GAD-7, and ADHD rating scales are the most common qualifying instruments. Clinical interviews and non-standardized questionnaires do not qualify. Bill those separately under the appropriate code. CPT 96127 can only be billed up to 4 times per patient per date of service. Regardless of how many assessments are given, the billing cap is 4 units on a single date. A PHQ-9 is 1 unit. A GAD-7 is a 2nd unit. Each validated instrument counts separately. A 5th unit on the same date is overbilling. If it is a pattern, expect a payer audit. The instrument must be scored per its guidelines, but the provider need not be present for administration. The assessment can be self-administered by the patient or given by clinical staff. A qualified provider must score the instrument and integrate findings into clinical decision-making. Documentation is the make-or-break factor for 96127 claims. Document the specific tool used and the clinical reason the screening was performed for this patient. Record the raw score and the interpretation band, what it means clinically. Capture how the results influenced clinical decisions in the EHR note and treatment plan. Bundling edits and knowing when modifier 59 applies are the 5th requirement. Commercial payers apply NCCI edits that may bundle 96127 with certain other CPT codes. Modifier 59 can override a bundling edit, but only when documentation genuinely supports separate services. Attaching modifier 59 without documentation support is an audit flag. Use it only when the facts require it. Rules vary significantly across payer types. What clears one may trigger a denial with another. Medicare reimburses 96127 alongside an EM code when medical necessity is documented. Verify current rates via the CMS physician fee schedule. Some state Medicaid programs allow 96127 standalone. Others require bundling with an EM on the same date. Aetna, United Healthcare, Cigna, and Blue Cross Blue Shield reimburse 96127 when documentation meets their requirements. Behave Health is designed to help behavioral health organizations build the documentation trail 96127 billing requires before the claim goes out. The Behave Health EHR captures instrument name, raw score, and interpretation band directly in the progress note. Outcome trajectory flows to the treatment plan so payers can see each screening informed clinical decisions. The revenue cycle management layer is designed to flag bundling rules and unit overages before claims are submitted. Stop losing 96127 reimbursement to preventable denials. See documentation and RCM built for compliant billing. See how Behave Health captures assessment scores, links them to treatment plans, and flags billing issues before submission. Book a demo at behavehealth.com.